In 2020, we've heard a lot about structural racism in the law enforcement field, but not so many people realize that also happens in the medical field. Evening's Jim Dever talked with Dr. Rachel Issaka from Fred Hutch about the issue.
It's really important to know what structural racism is, right? So it's not the racism between people, it's rather the racism that's built in and baked into our society by policies and practices that advantage one group and lead to the disadvantage of another group. So I published this essay in JAMA about structural racism in medicine, and I began with a patient encounter. And it was an encounter in which the patient was having a difficult time accepting that I too was a physician that was part of their team. And so their response when I introduced myself by my name and title, as other members of my team had done, and after they had acknowledged that, was to tell me, "Good for you." And I really use that as a way to highlight how, even though that was an intrapersonal experience, that structural racism is really at the root of that. And the reason is because within the healthcare field, for generations, white men were the picture of who a doctor looked like. And so for many patients, that's still who they envision when they are thinking of who's going to provide their care. So that structural racism that exists in medicine not only leads to those types of encounters, but it also leads to poor patient outcomes.
In writing this essay, so your goal then was to let people know this is for real. Is that right?
Absolutely. So after George Floyd was murdered, there was a march here in Seattle where over 10,000 doctors, nurses, and other people who work in the healthcare sector were out protesting and marching and really demanding change for how the justice system operates and treats Black people. But during that same time, there wasn't a conversation around how racism operates within medicine and how that too could, lead to poor outcomes, including death for Black people. What I wanted to do with this essay was to bring attention to that topic and to change the conversation to push us all to begin to talk about the impact of racism in medicine and to urge everybody to do something to fix it.
This is structural racism. Yes, it occurs through the way people treat each other, but it's not about a personal failing. It's about a structural, a widespread failing. As a white male, I always look at an issue like this or something similar and say, what can I do? How can I be an ally? How can I help change the situation?
I think the first thing that we can do in recognizing that it's due to policies and practices that are in place is to make sure that our voice is represented in local and on the national political stage, to make sure that the people who are writing policies, public health as well as other policies really are informed so that they can make decisions that improve the care of all individuals, but specifically Black people, as well as other underrepresented minority groups that have been disproportionately impacted.
In terms of beefing up the numbers of underrepresented people within the medical system, what can we do as a society to make sure that our medical professionals look more like us as an entire society?
There are several strategies, and I'm going to highlight 3 today. So first, institutions and organizations should invest in pipeline programs to encourage young people to pursue medical professions, young Black, Hispanic, Native American people to pursue these professions starting at a young age, so elementary school and upward. Second, medical schools that are affiliated with historically Black colleges and universities require investments. I was really pleased when I read the news about recent large donations from Bloomberg and others to historically Black medical schools and universities. And there was a study that came out that said that had 5 of 12 historically Black universities and colleges, if those had remained open after 1910, when there was a deliberate attempt to defame those institutions, had 5 of the 13 remained open, that there would be an additional 35,000 Black doctors in this country today. And that would have been almost 30% of the Black doctors would have graduated in 2019. And the third recommendation that I have is that institutions that recruit Black faculty, that they really have to provide the money, time, and space to ensure that those Black faculty members are successful. There are high rates of burnout amongst Black faculty members who aren't supported in academic institutions. that leads to them leaving for industry. And that's really not a good situation. So we want to support those individuals once they're at the institutions.
Structural racism, literally a life and death issue. Thank you for pointing it out and talking to us about it.
Absolutely. Thank you for having me.
A lot to think about. We'll be right back.